So one day you're doing great and the next day you're told that you have cancer. And what you hear next is that you need major surgery. Well, not necessarily. There is one type of cancer that can be treated successfully without surgery. Yes, believe it or not, there are treatment alternatives to surgery, which can be either partial nephrectomy or radical nephrectomy depending on the type and size of the tumor. Today, we are going to talk about this type of cancer, the kidney cancer. We'll tell you all about the kidney cancer, including the latest research and development regarding its alternative treatment without surgery. Stay tuned till the end. And if you love valuable content like this, subscribe for more. Welcome to our channel, the place where medical information meets you. Before we dive into the topic, let's take a moment to introduce ourselves. We are medical doctors from India. And we bring you greetings from New Delhi. You can call us Neonika and Karma. Through this platform, we aim to medically educate and empower you so that you can make healthier decisions regarding your health. Okay, let's get started. What is kidney cancer? To understand kidney cancer, we must first learn about our kidneys. Each kidney is shaped like a bean and is about the size of your fist. They sit just below your rib cage on either side of your spine. Kidneys serve as your body's natural filters, removing waste and extra water from your blood to make urine. They also play a role in regulating blood pressure, producing red blood cells, and keeping your bones strong. But did you know that your kidneys contain millions of tiny nephrons? Each nephron is like a miniature filtering unit working tirelessly to keep your blood clean and your body balanced. Sometimes, though, things can go wrong. Healthy kidney cells can turn cancerous. This uncontrolled growth forms a tumor. In most cases, kidney cancer starts as a tumor in just one kidney. This is called a solitary kidney mass. Most kidney cancers are a type called renal cell carcinoma, or RCC. Around 90% of all kidney cancers are RCC. There are other less common types of kidney cancer, but they make up a small percentage of cases. Who gets kidney cancer? Although the exact cause of kidney cancer isn't fully understood, several risk factors can raise your chances of developing it. Here are some of the factors that could increase your risk. Smoking, by far the most significant risk factor for kidney cancer, is smoking. The risk increases the longer and more heavily you smoke. So quitting or avoiding cigarettes altogether is essential for reducing your risk. Obesity. Maintaining a healthy weight is vital for your overall health and reducing the risk of kidney cancer. The more overweight you are, the higher your risk becomes. High blood pressure. People with high blood pressure might face an increased risk of kidney cancer. While the risk might come from the condition itself, it could also be related to some blood pressure medications. But don't worry. Many blood pressure medications don't increase your risk. Talk to your doctor about the safest ones. If you already have kidney cancer, controlling your blood pressure is crucial for its management. Workplace exposure. Prolonged exposure to certain chemicals at work might increase your risk. These include cadmium and the solvent trichloroethylene. Make sure to follow safety guidelines and use protective equipment if necessary. Family history. If you have a close relative, like a parent, sibling, or child who has had kidney cancer, your risk might be higher. Certain inherited genetic disorders, such as von Hippel-Lindau disease, can also increase your risk. Signs and symptoms of kidney cancer. Kidney cancer is nicknamed the silent killer because early-stage kidney cancer often shows no symptoms. This is why regular checkups and screenings are so important, especially if you have risk factors. However, as the cancer grows, it can cause various symptoms. Here are some signs to watch out for. Blood in the urine. One of the most telling signs of kidney cancer is blood in the urine. The blood might make your urine look pink or red, or it could have a cola-like color. Keep an eye out for any unusual changes in your urine. A lump or swelling. A noticeable lump or swelling in your back or side under the ribs could indicate a tumor. If you feel something unusual, don't hesitate to discuss it with your doctor. Persistent pain. A constant dull ache or sharp pain in your side or lower back that doesn't go away might be a warning sign of kidney cancer. Other signs, as the cancer progresses, it might cause additional symptoms like loss of appetite or unexplained weight loss, constant tiredness and lack of energy, and a fever that's not due to an infection. Diagnosing kidney cancer. If you experience any worrying symptoms or your doctor suspects kidney cancer, they'll probably refer you to a specialist called a urologist. The urologist will conduct a thorough examination and ask about your symptoms and medical history. They may also order several tests to diagnose and stage the cancer. These tests include a blood test to check for blood and an imaging test like a CT scan or MRI to get detailed pictures of your kidneys. In some cases, your doctor might need to perform a biopsy to examine kidney cells under a microscope to confirm the diagnosis. Staging kidney cancer. After confirming the diagnosis, doctors will determine the stage of your cancer. Staging helps them understand how far the cancer has spread and plan the best course of treatment. Generally, kidney cancer staging involves 4 stages. Stage 1. The tumor is relatively small, less than 3 centimeters, and is confined to the kidney. Stage 2. The tumor is larger than 3 centimeters but is still only in the kidney. Stage 3. The tumor has grown into nearby tissues, such as major veins or lymph nodes. Stage 4. The cancer is spread beyond the kidney and fat around the kidney or to distant parts of the body, such as the lungs, bones, or brain. Knowing the stage of your kidney cancer helps your healthcare team decide on the most appropriate treatment options. How is kidney cancer treated? The primary treatment options for kidney cancer include surgery, cryoablation, radiofrequency ablation, targeted therapy, and immunotherapy. Surgery. The main surgical options are partial nephrectomy, which removes only the tumor and some healthy tissue around it, and radical nephrectomy, which removes the entire kidney along with the tumor. Cryoablation and radiofrequency ablation. These procedures destroy cancer cells using extreme cold or heat respectively. They're often used for small tumors or for people who are good candidates for surgery. Targeted therapy. Unlike traditional chemotherapy, which uses drugs to kill cancer cells regardless of their specific characteristics, targeted therapy focuses on the unique features of cancer cells. These drugs can target different aspects of cancer growth, such as blocking signals that tell cells to divide or cutting off the blood supply that nourishes tumors. Immunotherapy. This innovative approach harnesses the power of your own immune system to fight cancer. Immunotherapy drugs help your immune cells recognize and destroy cancer cells more effectively. Radiation therapy and chemotherapy. While less common, radiation therapy and chemotherapy can still be helpful. They are usually used to relieve symptoms like pain if the cancer has spread. Can kidney cancer be treated without surgery? Yes, absolutely. There are treatment options available that eliminate the need for surgery. 2 minimally invasive techniques, cryoablation and radiofrequency ablation, offer effective alternatives to surgery for suitable candidates. These methods can destroy kidney tumors without the need for an incision, making them attractive options for many patients. Besides these, targeted therapy and immunotherapy have revolutionized the treatment of kidney cancer. Initially, chemotherapy was the go-to option after surgery for kidney cancer. However, it wasn't very effective for most kidney cancers. With the advent of targeted therapy and immunotherapy, the outlook for those with kidney cancer has significantly improved. Now, instead of relying solely on traditional chemotherapy, doctors can utilize these innovative approaches to combat the cancer. Living with kidney cancer. A diagnosis of kidney cancer can be overwhelming, but remember that knowledge is power. Learn as much as you can about your condition and discuss any concerns with your healthcare team. By staying informed and engaged in your treatment, you can make the best decisions for your health. Ask questions, explore clinical trials, and consider joining support groups to connect with others who understand what you're going through. Remember, you're not alone. Conclusion. Kidney cancer is a disease that affects thousands of people, but it's not a death sentence. With advancements in medicine, there are various treatment options, including non-surgical interventions like radiofrequency ablation and cryoablation. These methods can be game changers for individuals who are unable to undergo surgery or prefer to explore alternative treatment avenues. And with targeted therapy and immunotherapy, the future looks brighter than ever before. So if you or someone you